So to start the conversation, so we have with HALO, so we're IP Video is the owner of HALO. We were acquired by Motorola Solutions in December 2023. How this will be very beneficial to you and everyone else moving forward is that the not only do we have our same engineering and development team that created HALO, but we also have the engineering development team for Motorola now. So they're working together. They're coming out with a HALO 4 coming up. Again, not only is the HALO already the #1 vape sensor in the world for what it does, and all-around smart sensor, but the 4 is going to be even better. Um, we were the first company to come up with the algorithm to be able to identify the difference between aerosol spray and vape incidents. When it comes to an actual product standpoint, we are the top-rated environmental sensor on the entire market. We've gone through multiple shootouts, things like 5 shootouts now with the HALO. In comparison to all the other manufacturers in the market, we've won every single time. And so this isn't just from accuracy, but it's also deliverability, it's ease of use. We also have a full API platform. So though we were acquired by Motorola, we do have full open API. We are completely made in the United States. So being that a lot of the applications for this are going to be in a K through 12 setting, many of those K through 12 organizations, they do purchase based on federal funding. So we are fully NDA compliant, we are TAA compliant, and we are UL listed. When it comes to UL listing, I always point out that we are not UL listed for fire alarms, but we are UL listed. So here, as I mentioned, I circled some of the main differentiators between us and any of our competitors out there in the market. So what you're seeing here for the HALO, this is a HALO 3C, same thing that you're seeing there on the icon. So HALO 3C has 15 sensors within it. The HALO 3C PC has a 16 sensor. That's a people counting unit, which ultimately is a 115-degree laser line that goes towards the entrance, especially a one-way entrance of, let's say, a bathroom. Counts up, it counts down the amount of people that are in that bathroom on a regular basis. Um, from there, I really like to point out massive difference between us and our competitors is we do truly process all the data here on the edge. Why is this important? If you're putting these in a bathroom, you have personal identifiable information. God, cat. You have personal identifiable information that is within a bathroom. So if you have a microphone element within the platform, there's a potential that it records audio within those bathrooms. Being that we process it on the edge, all of that data stays on this single device. We do have a help spoken word element of this platform, which is ultimately a verbal panic button. When that verbal panic button goes off, all that does is the verbiage from the microphone pulls the specific cadence of the sentence. There, it acts as a trigger within this device, sends the trigger out. The audio does not leave this device. Our competitors do, if they record audio, they do record it. And if they are cloud-based and that cloud or that storage facility, data storage facility is in a different state, you're now breaching federal contract or federal contract / just a federal offense for leaving state lines with personal identifiable information from a bathroom. So we don't do that, right? We really are keen on privacy when it comes to these devices. From a communication standpoint, whenever you have a event that you want to be notified on, we do send out both a text, an email, and now a push notification. So they do get access to an app. I mean, I've done hundreds of between city councils and school board meetings in my career. Every single time I position a technology, they always ask, if I'm going to spend this much money, what's my return on investment? What's my data showing me that this is effective? With the data, you're going to be able to understand where you're at today through, let's say, the proof of concept that you put in for 30 days. And then you're going to understand where you want to be within the next 60 days or 90 days. And you can put programs in place. So if it is just for vaping, you could do somewhat of like a DARE program, or you have more initiatives internally, or your SROs are going to be trained on how to actually approach this and so on. So it's a lot of data you can get and then stories you can tell from that data.
I wanted to stop you real quick on that last slide, daisy chain. So these things, 4-wire PoE.
Yeah, so I don't know why I skipped over that. So yeah, I'll mention this a little bit. So when you look at this specific device right here, you have an in and an out port. So it's a 12-watt device. If I put you can put up to 2 devices on a daisy chain as of right now. And so if I have 30 watts coming out of a Cat 5, I now have 18 watts left after this 12 watts is taken care of. And so I can put one in the male bathroom, one in the female bathroom. It'll save a lot of cost when it comes to you.
Yeah, I'm only using one drop. Oh, okay, nice.
Exactly. And they both speak independently back to that switch. And so you're not going to have to take up switch space, ultimately. You're going to be able to go from one bathroom to another bathroom let's say I had a male bathroom and my female bathroom's too far away and I didn't want to daisy chain them, you still have 18 watts coming out of this device. So you can use that as a third party style PoE, right? So you have the ability now to have somewhat of a hub in that room to be able to then push power and Ethernet over to another device. You have 18 watts to work with.
Okay, and so each device is getting its own IP address, right?
Yes, each device gets their own IP address, exactly. And so one of the reasons why I push cloud even before we were giving free cloud is that to manage these things, we don't need cloud. Just to let you guys know, we do not need cloud for these to actually work. However, to manage these on enterprise scale, if I'm going to have a couple hundred units within my school district or within my office space, if I'm just server based, I'm managing everything based on a device manager that we have that you can install on the back end. Again, you don't need cloud for that. However, you're going to have to manage each individual IP address. When you have cloud, all of those devices roll up into the cloud interface. So it makes it a lot easier from enterprise scale to understand what's going on with those devices, where they're at, are they online, and so on. Everything's going to be rolled up from the enterprise standpoint. One thing I want to point out here, so external sensors. We have all the internal sensors, which I'll get to in a minute, from the 15 to 16 sensor readings, but we do have external sensors as well. So what I want you to think of this as is, even though this is a 16, let's say 16-in-1 smart sensor, it also has the ability to be a Bluetooth hub. And so we're coming out right now in August, September timeframe. We're going to be coming out with we have a temperature humidity sensor. So these are going to be external sensors. If you guys have a production facility, I have these in Oklahoma for cannabis facilities. There's a lettuce farm here in Texas that wants to use it, where you're going to be able to put a halo up top for environmental readings for the air quality and humidity, temperature, and so on. And then you're going to be able to put these external devices down at the product level. And so, if we're going to talk about, let's say, cannabis up in Oklahoma, if you lose, if your AC goes out one night and you're not notified on that, you come in the next morning, your entire crop is ruined. Like, I know my cousin, I'm from Maine originally, my cousin lost 250 grand in one night because his AC went out and he wasn't notified, right? So we just think of these different use cases for this. And so what I really want to look at this device as is only 20% moving forward of K through 12 applications, and we need to now look at 80% of the other market being outside of K through 12, because there are so many different applications, even from a air quality standpoint, motion standpoint in the bathroom when it comes to mustering situations and so on. So again, one external sensor is that temperature humidity sensor. One is a water flood leak sensor. We have a door window DPI that, again, they all link back Bluetooth. They're about 2-year battery life on each device. And we're coming out now with a thermal people counting sensor. And so what this is an external sensor that, yes, our devices can show people counting, but these will be up over individual stalls or single-use bathrooms is one application. So I'll understand how many people are in that stall. Anytime it gets to more than one person in that stall, you can immediately get a notification. I have a massive convenience store chain that we're talking about. They're having a big issue with fentanyl. So we're the only device in the market, if you think about us compared to any of our competitors, we're the only device in the market that can program logic into these actual devices. So in this situation, what I'm doing is it's airborne smoked fentanyl that they're having issues with. Their employees are walking in and passing out. And so they'll be able to have a logic in that bathroom that says if smoking is apparent and the person's been in there from the thermal sensor more than 20 minutes and they're laying down on the ground based on the head positioning box of the thermal sensor and they're no longer moving, I can send in or call EMS. I do not need to send my employees in. So this is all to say that we have logic in these devices. So what you want to do, we can likely come up with a solution for it. I can't tell you fentanyl's in that environment, but I can tell you based on history with that location, the amount of fentanyl incidents they're seeing, if smoking is apparent and all of these other parameters are met, there's a high likelihood from deductive reasoning that you do have an incident in that location. So from an environmental reading, every single manufacturer out there, I'll just put that in quotes, will be able to tell you different environmental readings. What's the temperature, humidity? What's my carbon monoxide, dioxide, nitrogen, and so on inside that environment? Here's the problem. If I'm a principal, if I'm a resource officer, if I'm an admin at a commercial facility, I really don't know what it means when CO's up, CO2's down, NH is up, and so on. Like, I don't know. But the way that we deliver data is different. So we deliver data into two boxes here: air quality index, which is EPA data, and health index, which is CDC data. I want you to think of a stoplight. Green is go, orange is slow down or not so good, red is bad. That's how we're delivering data. That's all they need to know. If at one point during the day their air quality goes from green to red, they need to figure out what's going on in that environment. This being said, there's a lot of studies out there right now when it comes to the attention span of children when they're in a low air quality environment. So say carbon monoxide's high, short-term memory retention and long-term memory retention. I've had 3 times in my career so far where they're all separate instances over a couple of years where I've seen the air quality in a specific environment tank at a certain time of the day. It's very weird. And so when we started doing investigation into it, we found out that in each instance, the HVAC system was actually exhausting back into those bathrooms during that certain time of day when the HVAC system turned back on. You would have no clue about this unless you had a device like this, because humans can't smell or taste these different readings that are out there in the atmosphere. This device can smell and taste everything that we can't and give you data on that. We can't have cameras in the bathroom, but we can have data points in the bathroom, and that's what this device will ultimately do. And that's air quality. With health index, so again, air quality is EPA data, health index is CDC data. With CDC data, if you think of a hospital setting, you think of a school setting, there's a 300% increase in the potential for airborne viruses to be transmitted when you're at a unhealthy to a bad health index. Again, we're just going green, orange, red. If I think of a hospital, part of hospital scoring system is about the retransmission of diseases and viruses. Their Medicare costs funding, their insurance funding can be revoked, and they'll lose their licenses altogether if they have a retransmission of diseases past a certain metric. That is why now our second largest market behind K through 12 is hospital, right? So I want you to think of the different applications outside of K through 12 for this, and it might just be air quality. And I know in some states now they have, for office buildings, you have to have a certain air quality reading at all times within those office buildings. If it goes beyond that, it's a potential for mold growth and so on. But there's different regulations. So I want you to broaden your horizon on how this thing could actually be used. On this, again, coming from the competition, I circled some of the main indicators or differentiators between us and any of our competition. Health index and air quality, no one does that. So we do break it up data differently. We do show carbon monoxide, dioxide, nitrogen dioxide, ammonia, which is not in here, but we do read it, humidity, temperature, TVOC, so total volatile organic compound, which is your aerosol sprays, and particulates. So if we look at their competition on the market, most of them, they read PM, so particulate matter, 2.5. It's the size and the granularity of how deep I'm going into that air molecule. We do it differently. So yes, we do read on PM 2.5, but we also read PM 1.0, which is extremely small, and PM 10, which is quite a bit larger. Why? Because some of these different algorithms, like if I look at like THC doesn't pop and doesn't notify at something like a 2.5. You actually have to go deeper into that air molecule to get an understanding of where THC is. This also is why, for the shootout standpoint for IPVM, we keep winning, because we are able to dive deeper into particulates that no other manufacturer is able to do. So that's the health index. So we do differentiate between THC, nicotine. These are both oil-based vapes, vape masking, which is me spraying an aerosol spray and vaping at the same time. When those two chemical compounds meet in the middle, that then comes up as a vape masking event, and then smoking. So with smoking, I'm not going to be able to tell you that it's a fentanyl, cigarettes, or weed, but I am going to tell you there's a combustible smoke in that environment. With THC, however, so every single time, if I'm going to look at the ones I can buy here in Texas at the smoke shop or a gas station, so like your Delta 8s, THC A through Zs, right? The legals in Texas, the illegals, let's say, so like the medical quality stuff, all of those vapes pop for the same chemical compound, which is ammonia. Why? Because when you press down a plant, you can't put them inside of these vape cartridges without having a cutting agent. It will not work. And so the cutting agent that they use is ammonia. It has an ammonia component to it. The reason why I went from the top to bottom, so you got all your EPA data up top, you have now your FDA style data down below. The grants are different. So EPA, I get certain grants through that, air quality. I have ESSER funding that could have gone towards this. I have, there's some other airborne type of components that you can do for grants, if we're going to talk grant specific. But then when you go down to vaping, again, you're looking at your FDA, certain task force grants. You look at, there's a Juul grant out right now, fentanyl prevention. You can go down the list of those, but still, they're very tiny grants. They're very specific. The reason why I mentioned that is that in the middle here, we have safety. And so safety is a very different group of grants or fundings that I can now go into. So I don't just need to dip into even my general funding in certain elements. I can now dip deeper into like safety and security budgets or IT budgets or infrastructure budgets and so on because of these. With the verbal panic button, the way I always describe this is we had a story out of Florida where this teacher, she has a history of medical conditions. She all of a sudden admin got notification to go down to the bathroom. When they showed up to the bathroom, she's passed out on the floor. And when they talked to her afterwards, they said, "How did you call us?" She said, I did the keywords that you guys told me to say." So on these, it's like I'll show you in a second. I think it's like 20 by 20 box. But I can go help emergency. These devices then recognize in real time. Security. The cat's gonna freak out. So both devices, my Sentry ERF device and my HALO device, will now initiate. That immediately sends a response down to admin. Admin then goes down to the bathroom to check out what's going on there in real time. And so that's the help spoken word component. We have emergency escape. So on these specific devices, I know it's hard for you guys to see, but there are LED lights sequence that turn into the HALO. The LED light sequences do show up as a arrow if you want to program it to do so. So if I wanted to point it towards the door, coming out of the bathroom, you could do that in the instance that there might be a fire or something you can't see. This would be able to then send you a light sequence showing you exactly where the exit is. Panic buttons. So we do have physical panic buttons. Right now, this is version 1. We have these connect to both the HALO device and the Sentry ERS device. So if I have HALO's in my bathroom and Sentry ERS device inside my classrooms and communal spaces, these read about 35 feet. They're Bluetooth, and that's a limitation, but it's also a positive because at the end of the day, if I can have these devices throughout a facility, I can geolocate exactly where that response came from, not just the west hallway, but room 101 within the west hallway or bathroom 102, right? So ways that we can actually narrow down exactly where the panic button response came from. We do tell you occupancy and then gunshot. Very few manufacturers, if any, on the market who are willing to do this because it's a massive liability. But we are now Motorola. Motorola is not going to let this thing go wrong. And so in terms of gunshot, we have it's third party tested. We've understand the difference between a loud noise and a gunshot in an enclosed environment. And so the way this reads is a significant pressure increase and decibel increase that marry up at a certain point, then comes up as a gunshot. I can't tell you that it's a 22 or 9 millimeter, but I can tell you that there is a gunshot inside an enclosed environment. Pressure is very, very loud, and that will spike as well as decibels. And that's the same thing for both the HALO and the Sentry device. Whenever I talk to principals right now, when I ask, what are you actually using the system for? They tell me it's 3 things at this point, or 2 things even. Vaping, so THC, nicotine vaping, and aggression. Aggression will spike when there's a 30-point increase over the normal decibel limit of that exact time period. And so if I have kids going in the bathroom there, this can be a bullying prevention, this can be fights in the bathroom, but also could just be horsing around. And so I heard this twice last week, and it kind of surprised me, where the principals, both in different instances, said, "I'm trying to regain control of my bathrooms." This is how you can do it, right? And so I'm going to be able to get data from those bathrooms. One of them is aggression. And so if kids are just horsing around the bathroom, you send someone down there to stop them from horsing around in the bathroom. They cannot think this is acceptable. And then they use it for vaping as well. So it's a multi-use style device. Let's say if we're going to talk about the school, if the school you're talking to doesn't have money in their budget for vaping, they may have money in their budget for gunshot detection or panic buttons, right? There are ways that you can manipulate this, I hate to say it that way, but manipulate some of the features of this detector, this sensor.
Interesting. I like that.
Right? So you change the way that they're paying for it. And so that's kind of
Yeah.
how I've sold a lot of these devices, because you have to change the way they think about it. Because the amount of times that I've brought projects forward when it comes to vaping, and how many of those have you guys ever pitched that those just get put on the back burner over and over and over? Let's change the way that we're actually talking about it. And if we talk about it differently, you are buying it as a gunshot detector for the places that you can't see right now, but it's also going to be coupled with free vaping. You can also think of
It's
this
turning
for
into a physical security device.
exactly that, right? And you're changing the funding source of these things and the initiative for them to actually spend money on it. You then have motion. So I'm getting into some very, very large accounts right now. So if we were to think of a couple of them, like ExxonMobil and Walmart, I'll throw out those two. I'm getting into those accounts right now because of motion, which is very interesting. But if you think about it, they're keen on emergency responses within their building. They need to make sure that, yeah, they have cameras all over the place. They understand from a mustering situation when the emergency response goes out, they're going through, they're figuring out who's there, who's not accounted for. They can look at their cameras and figure out who's still in the building, but they can't look at their bathrooms. And so now what they're doing is they're putting these in their bathrooms for motion. So now if I tie all this data together, the people counting and the motion within those bathrooms, I'm going to understand if someone's still in that bathroom. This right here, I just want to point out. So, though we are, as I mentioned in the first slide, though we are Motorola right now, we do not just work with Motorola. So, you're seeing your major, just a couple, literally a couple of the major VMSs that are out there right now. We do work with VMS, access control, even visitor management system, intercom, mass notification systems, BACnet certified on this thing, full integration. You go down the line, we're going to work with them. If we don't work with them right now, as long as they have the ability to have an open API or a real-time streaming protocol, we can work with their devices. And so part of that from a camera standpoint, so we think of how we compete with other manufacturers. A lot of manufacturers out there, or the one you guys were talking about earlier, is closed system, right? They're only going to work with their cameras and their vape sensors. With me, what I'll do is I open that up. And so I can now link with any and all of the ones you see here, plus another, 60, 70 of them now. And with that, it'll be the same type concept where 2 minutes before the event, 2 minutes during the event, 2 minutes after the event, you're going to have a notification showing you who's been in that bathroom, who's now out of that bathroom, with the overlay of our sensor data in the bottom left-hand corner of that video feed. So here we're here from a mounting standpoint. The reason why I really put this on this slide is I just want you to see kind of where the radiuses are. So we have a 144 square foot box for vaping, 20 by 20 for aggression keyword. I was at a school a little while ago and the IP director was trying to quote trick these devices. He walked out into the hallway and said the keywords and it still worked. Right. So you can be quite far away from these things and still have it recognize the verbal keywords. Gunshot 25 by 25. But if you're seeing air quality, that's a 3,600 square foot. And with air quality, I can actually install these on the walls if I wanted to, not necessarily on the ceilings. All these other ones are best if you put them on the walls. Slash vaping, I'm sorry. All the other ones here are best if you put them on the ceiling. I would absolutely put them on the ceiling. So same thing with vape. Like think of when I light a match, where the stream of smoke goes, it goes up. That's what we're trying to do with this, is be able to capture the smoke that goes up and is left from those vaping devices. It's about the 8 to 9 foot deployment. So if you have a drop down ceiling, fantastic. Hard mounting, we have back boxes for these. But if you have a 15-foot ceiling, you're going to have to put a mask going down again, because we need accuracy with these devices. It's about 3 to 4 stalls wide for these when it comes to deployment for the most accurate results. I just want to point out some of the industries we work with. This is only a smart device. There's so much more we could tell from a data standpoint that we're just not telling right now. So K through 12 is our number one industry. Then it goes hospitals. Then it goes public housing. You just keep going down this list, though. We have these deployed in prisons. I have a lot of conversation right now with casinos for their bathrooms. We have warehouses from an air quality standpoint. Churches, grocery. Again, it's important to know, is your freezer going or your fridge going out in a certain location and so on. This is the on-prem version. You get server base, you're just gonna get notifications in real time. It's sitting right behind me, so it's telling me there's motion in this room. My cat just went to the bathroom, so you see my CO2 level went up. Like this thing will start tanking when they just went to the bathroom over time, but you'll get all your different readings. But again, this is the on-prem version. What we're pushing everyone to get is the cloud-based version, and here's why. So instead of, see how this is an individual IP address, instead of monitoring it on an IP standpoint, I want to monitor it on a cloud-based standpoint. And so every single one of my devices will be here in real time. All my events that come up will be logged. We have all of the hotspot analysis, what we call it, in terms of how many instances are happening today, this week, and so on for these individual rooms. I really like this. We do break it up from 12 a.m. to, let's say, 11 p.m. I'd be able to understand in which room has the most amount of occurrences throughout this week, let's say, or last week. You use strategy to go. I also have some people where they're not even going after nicotine anymore, just because they have 1,000 devices through their school. They're more just going after THC. You do the same thing with this. Where are the kids most likely to be right now based on the data to be able to smoke THC? Once you get a notification, you're down there because you're right down the hallway already waiting. And then all your event trends will be here. Where are you at today? Where do you want to get? And how are you trending in the grand scheme of things? All of the different units are going to be here, placed throughout the facility from a map standpoint. And then analytics that can break down to every single sensor individually, really make sure. And it's the same thing with all manufacturers, because they're algorithms. I always like at some point to make sure that, if I see THC and THC in the state of Texas will make it so you go to jail, I want to make sure that's the THC. I can just dive deeper into the sensor in real time and just make sure everything links up. Again, we're going to tell you it does, but I'm always I'm a fail-safe type of guy. Every once in a while, I'll go in here and just make sure everything links up and it all looks good. You'll have full reporting and analytics as well. So I and Chris Fiore here on the line, like we are here as a resource for you. So do not think you have to be an expert for it. Tee it up, call me up. I'll get in the conversation, whether it's remote, if it's a large enough project, I'll be there in person with you. I've always, my entire career has been end customer focused. I've sold some massive clients in my life. I will help you guys sell this thing. I will demo it. I'll do anything you need to make sure that we ultimately win this deal. Just let me know how I can help you. That's all I ask.
Sounds good. I like it, man.